At the outset, I would like to thank Kerala Ophthalmic Society for giving me this honor. My paper is titled Anterior Segment OCT Biomarkers in Recurrent Corneal Erosion Syndrome. As we all know that recurrent corneal erosion syndrome is a debilitating disease, and it still remains difficult to predict recurrences in this disease. And till date, only slit lamp examination is used for the follow-up in RCS. So the aim of our study was to look at the AIOS2025 and the AIOS2025 epithelial mapping changes in RCS patients and the capability of these AIOS2025 biomarkers in predicting the future recurrences in RCS. So this was a retrospective study, and the charts of the patients presenting with typical RCS symptoms were enrolled, and in the history, the cause of the initial insult, the duration of the recurrence, the time gap between the recurrence and the frequency of the recurrence was recorded. Based on the history of frequency of recurrence for this study, the RCS patients were grouped into group F, that is the frequent recurrence group, where the patients complained of at least one episode of pain in a month, and a rare recurrence group where they complained of less than one episode every 2 to 3 months with a normal intervening period. All patients underwent slit lamp examination, AIOS2025 scanning and epithelial mapping. The RCS area of interest was marked in the clinical diagram, and the patient was subsequently sent for AIOS2025 scanning of this RCS area of interest. Along with that, the epithelial mapping was done, and the area of epithelial thickening was demarcated as a hot spot, and we also looked at whether this hot spot corresponded to the clinical diagram that was drawn in the OPD. So as we all know, these are the AIOS2025 changes in a cornea. And these were the changes that we noted commonly in the RCS patient, that is epithelial hyperreflectivity, epithelial detachment, epithelial edema, and in some cases intraepithelial hyperreflective inclusion bodies. And in the epithelial basement membrane Bowman's membrane complex, we noticed that in the area of RCS it was absent, and also there was hyperreflectivity of the BMBM seen in some cases. And this is also anterior stromal haze was seen in some cases. In AIOS2025, as I've already mentioned, the hotspot was seen, and we looked at whether it corresponded to the clinical diagram. So coming to our results, 36 patients were enrolled, and more than 50% of the patients complained of symptoms for more than a year. Around 70% of the patients fell in the frequent recurrence group and 30% in the rare recurrence group. Though most of them did not remember an incident of initial trauma, fingernail injury was the most common cause of trauma. Coming to the AIOS2025 changes, more than 70% of the patients in both the frequent recurrence as well as the rare recurrence group had epithelial and the BMBM changes. Stromal changes were rare, but when we compared it between the two groups, BMBM changes was more statistically significantly more common in the frequent recurrence group. So this shows that the BMBM changes occurred more in the frequent recurrence group, and epithelial changes was exhibited. Though exhibited by majority, there was no significant difference between the two groups. Coming to the AIOS2025 epithelial changes, the hotspot was seen in 90%, more than 90% of the individual, and it also corresponded to this clinical diagram drawn in the OPD in more than 90% of the patients. But it was not statistically significant between the two groups. So as we all know, fingernail injury has been documented as one of the most common changes, and OCT changes have been studied in the past, but more commonly in the acute and chronic patients, and ours is probably the first study which has differentiated patients into frequent and rare recurrence group based on the history. And we have noted that though epithelial changes are seen in majority, it is not different between the two groups, and BMBM change is the only one which is significantly more common in the frequent recurrence group. Hence, this could be a predictor of increased recurrence if noted on the AIOS2025 changes in the RCS patients. So, slit lamp examination which documents only epithelial changes might be highly inadequate in prognosticating these patients. Epithelial mapping changes have also been studied in the past for targeted stromal therapy with good success. We agree with the study that it does delineate the area of RCS well, but it cannot predict the patients who will have more frequent recurrences. So in the past, slit lamp examination has been the way to study RCS, and has just as imaging has revolutionized many treatment, we also recommend that along with the slit lamp examination, epithelial mapping should be included in follow-up RCS patients, and AIOS2025 scanning of the RCS area can be used to delineate the layer of involvement, and if BMBM changes are noted, we would suggest an early intervention to reduce the morbidity. The limitation of our study is, of course, its retrospective nature and a small sample size. But to conclude, in future, AIOS markers could help clinicians alleviate morbidities associated with RCS. Thank you for your patient listening.
You did all these studies in cold cases, no? When there was no acute lesion, when the eyes had healed.
At presentation, all the AIOS scans were done at presentation. When the patient presented with the episode, sir.
Okay, thank you.